Welcome to Sleep Better TV. The role of general dentistry and orthodontics in recent years seems to have grown in the diagnoses of different kinds of problems, including TMJ and OSA and other airway related problems. My guest is Dr. Steve Lawson with the TMJ and Dental Sleep Therapy Center of Winnipeg. Dr. Lawson, always a pleasure. Welcome back.
Well, it's my pleasure.
You know, it seems logical that a dentist who is probably seen, I would say, more often than a general physician for things, especially with kids,
Sure.
could act almost as the first line of defense when it comes to problems that we just discussed, especially sleep disorder problems and chronic pain like TMJ.
Yeah. Yeah, if I could, if I could turn the clock back, and how many times in our lives do we say, "Gee, if I only knew then what I know now, I would be doing things differently." And yeah, you're right. We, in a general dental office, we're seeing patients, twice a year, even once a year, but on a fairly regular basis, and we have an opportunity to look and observe. Historically, you go to your dentist and you get your teeth checked and you might get fillings looked after and things like that. But boy, now if I had a patient walk into my office and I'm doing an examination, you're getting the patient open so I can look inside, well, then I start to maybe observe or be mindful of the fact that there maybe is some joint noise. Be mindful of the fact that maybe they have a limited ability to open their mouth pain-free, because who else is going to see that better than a dentist? And to be honest with you, in terms of TMJ and chronic pain, I don't need fancy equipment to do. I like the equipment I have, and it helps me do what I do better. But from a diagnostic perspective, I can take a ruler in my finger, and I can do range of motion, and I can do muscle palpation, and I can conclude and do a pretty good diagnosis without a lot of really high-tech equipment. If I have a patient who's in again, for an examination, and I look in their mouth, and I see their teeth are all worn down, or I see scalloping of the tongue, or what we call abfraction lesions, which are these little notches out of our teeth at the gum line. Well, first thing I'm not looking at is, gee, this person's clenching and grinding. I'm thinking airway. I'm thinking, wait a minute, why is this person wearing their enamel down? Enamel is an awfully hard material. Why do we have scalloping of the tongue? So I would look at things totally differently. In terms of just having some red flags being waved at me as to, well, I wonder what else is going on here. Because if it's a TMD issue in its early stages, for example, boy, a lot of times I could treat a patient in a very simple, inexpensive way by dealing with what's going on at night. And the same thing, of course, applies with any evidence of snoring or obstructive sleep apnea. Let's find the source of the problem here. Let's see why the teeth and the oral cavity and the head and neck area is looking the way it is.
Because of the comorbidity that OSA seems to be a part of with so many other problems, it seems logical that as a dentist, when someone presents with symptoms of other things going on, you may look at OSA as a problem that may have been missed before, right?
Oh, absolutely, yeah. There's many clinical signs of OSA and or upper airway resistance. Sleep disordered breathing in general is a larger context. But yeah, there are a lot of clinical signs that I'm aware of now that I certainly would not be aware of, nor would I be aware of it now if I hadn't had a lot of training, taking a lot of courses, and spent a lot of time with people who do this and who become proficient at diagnosing and treating these entities. But yeah, as a general dentist, we are certainly the front line. We're on the front line. And you know what? It seems like a month doesn't go by now where there's not another link between sleep apnea and sleep disordered breathing and its negative effects on the health. Recent studies are pointing to, we know this actually, but depression, silent strokes, and small brain lesions, abnormalities in the blood vessels, high blood pressure, heart disease, strokes, even sudden hearing loss, and women should maybe take note here. Sleep apnea has been linked to dementia in older women, and another study has found that women with untreated severe OSA are 3.5 times more likely to die from cardiovascular disease, than women without OSA. So to be in a position on a regular basis in a dental office to to at least be mindful of signs of this particular entity and this disease is sadly being missed, I think, in our dental profession.
Once again, my guest is Dr. Stephen Lawson. He is with the TMJ and Dental Sleep Therapy Center of Winnipeg. Dr. Lawson, always a pleasure. Thank you.
Well, my pleasure. Thank you.